Well, as we begin to wind down the month of May, we wanted to let you know about an uplifting program during National Mental Health Awareness Month. Stacey and Hillary Estes are here this morning with SSM Health DePaul Hospital with more on what they're doing there. Good morning to both of you.
Morning.
Yeah, so this is a special healthcare initiative. It's called the Buddy System. How does it work?
So we have several patients in behavioral health that are long holds, have been there quite a while, who are having challenges finding placement, somewhere to go. Some have been there up to 500 days. Recognizing this and their lack of positive relationships in the past and consistency of visitors, and that the only visitors that they would have come in would be people coming to assess them for placement, lots of rejection. Recognizing that, went ahead and decided, had conversations with a manager over at DePaul Hospital who volunteered and said, I'll come visit them, I'll be their buddy. So that kind of grew into this program now where we have people volunteering within DePaul campus only to come over and see their buddies once a week for about 30 minutes, just to create that lasting relationship, give them something to look forward to, show them what a positive, healthy relationship is. And it's just really gone well. We've had a lot of success, a lot of people coming and donating their time to us.
That's fantastic. I know it just started at the beginning of the year. What kind of response have you received from the patients?
I think that on many levels, I mean, as she mentioned, the fear of abandonment and rejection. So having something to look forward to, there's been changes in behavior, so more positive behavior for patients. It incentivizes them to stay in tune with their programming, to have good interactions with staff and with others, and really seeing some success in patients that have been here for quite a long time, turn it around, right, and have more positive behavior on the unit. So it helps them for their long-term goal of finding a place to go and then being successful when they get there.
Yeah, I feel like we saw during COVID so much isolation and the negative impacts of that we do need people around.
Absolutely,
Yeah.
absolutely.
And that buddy system is certainly providing that for them. They don't feel as isolated.
Correct, yep, they have, and they look forward to it. One thing that I've noticed of building trust, I have a patient who comes every day and says, is she coming on Wednesday? Is she coming on Wednesday? And to say to her, trust that she'll be here. And the fact that she shows up every Wednesday on time and spends that 30 minutes with her has made a big impression on that patient. So.
And the volunteers, I mean, how rewarding has it been for them?
That I can't speak to, but they seem to really enjoy it. They stop by my office when they leave and notice changes even in their patients. You know, they'll say, oh my gosh, she's smiling and it's a genuine smile this visit, you know, their third or fourth visit in, and just having a great time. I think it fulfills them as well, you know.
Can anyone be a volunteer?
Right now, we're just doing employees at DePaul because of the confidentiality and obviously HIPAA laws, just to make it easy for them. It's just DePaul employees.
Do you see other hospitals maybe doing something similar to this?
I guess I had been asked that before. My hope would be is that we won't have this need forever, that there won't be long hold patients that require buddies. But if there are, I would like to see other facilities do it as well. That would be great.
Absolutely.
I think it's good to think outside of the box in situations where it's less than ideal to find ways to push through and find rewarding programs for our patients. So
to be able to meet all their needs, you know, socially especially, that lacks when you're in a hospital for that long.
Yeah, it's not just medical. And sometimes that social, my grandparents used to always say, Margie, you're the best medicine for your granddad, right?
Absolutely.
And I think there is something to that.
Absolutely agreed.
All right. Stacey and Hillary, thank you both for being with us this
Thanks for
morning
having
and
us.
sharing your buddy system with us.